Here are some pregnancy birth ball exercises. Number 1. Pelvic tilts on the ball benefits, strengthens the core and relieves lower back pain. How to do: sit on the birth ball with your feet flat on the ground, hip width apart. Keep your back straight and your hands resting on your thighs. Slowly tilt your pelvis forward and back, gently arching and rounding your lower back. Number 2. Hip circles benefits, loosens tight hip muscles and promotes pelvic flexibility, which is helpful for labor. How to do: sit on the birth ball with your feet wide apart. Slowly rotate your hips in a circular motion, slow circles in one direction. Do 10 circles, then switch directions and repeat. Number 3. Figure 8's benefits, increases flexibility in the hips and lower back. How to do: sit on the ball with your feet firmly planted on the ground. Move your hips in a figure 8 pattern while maintaining good posture. Try to keep your upper body steady as your hips do the movement. Number 4. Seated bouncing benefits, strengthens the pelvic floor and promotes circulation in the legs. How to do: sit on the ball with your feet flat on the floor, shoulder width apart. Begin bouncing gently up and down while keeping your core engaged and your back straight. Keep the movement controlled. Do this for 1 to 2 minutes as a warm-up or cool down. Number 5. Leaning forward on the ball benefits, eases lower back pain and helps get the baby into the optimal position for labor. How to do: kneel on the floor and lean your upper body forward onto the birth ball. Let your arms drape over the top of the ball while keeping your knees hip width apart. Allow your back to relax and rock your hips gently from side to side. Number 6. Wall squats with the ball benefits, strengthens the legs and glutes while taking pressure off the knees, which is helpful for endurance during labor. How to do: stand with your back against the wall. Place the birth ball between your lower back and the wall. Walk your feet out a few steps so you're leaning slightly into the ball. Slowly lower into a squat position by bending your knees, making sure your knees don't go past your toes. Number 7. Bridging on the ball benefits, strengthens the glutes, hamstrings, and lower back muscles, which supports the pelvis during pregnancy and labor. How to do: lie on your back with your feet resting on the ball and your knees bent. Engage your core and slowly lift your hips off the floor into a bridge position, creating a straight line from your knees to your shoulders. Number 8. Supported squats with the ball benefits, opens up the pelvis and strengthens the lower body muscles. How to do: stand with your feet wider than hip width apart, holding the ball at chest height. Slowly lower yourself into a deep squat, allowing the ball to support your upper body by pressing it lightly into your chest. Number 9. Rocking back and forth benefits, relieves pressure in the lower back and helps the baby descend into the pelvis in preparation for birth. How to do: sit on the ball with your legs wide apart and feet firmly on the ground. Slowly rock your pelvis forward and backward while keeping your back straight. Number 10. Seated cat-cow benefits, eases tension in the spine and improves flexibility in the lower back and pelvis. How to do: sit on the ball with your feet flat on the floor. Place your hands on your knees. Inhale as you arch your back, lifting your chest and allowing your belly to drop forward. Exhale as you round your back, tucking your chin and pelvis under. Number 11. Tailor sitting on the ball benefits, improves flexibility in the hips and pelvis and encourages good posture. How to do: sit on the ball and cross your legs in front of you. Use the ball's surface to help support your pelvis. Thank you so much for joining me today for these pregnancy birth ball exercises. Staying active and moving your body can help you feel more comfortable during pregnancy.